No. Alright, so this next portion is going to be on applying sterile gloves. Alright, after you have done your whole scrub and you've put on the sterile gown, then you can put on your sterile gloves. And we use sterile gloves for many different reasons. Wound care, anytime you're using a sterile field. They come in different sizes. They are usually wrapped, and it tells you, obviously, if they're, sterile, because it says it right there, sterile, regular. No latex, powder-free. You get one pair, they're single use. So they tell you a lot of information just from the cover of it. Keep in mind that, if there's any question about sterility, it's not sterile. Okay. When you first get your package of gloves, you want to look and inspect it, make sure that there's no moisture in there, there's no tears. Inspections like that are important. So, let's see. Now we will put them on. I'll just adjust the camera so you can kind of see. When you open it, you open it just like this, and it's going to come in a closed package like this. Okay, this outside is not sterile, so you can touch it. When you open it, it just folds out like this, and it shows you your right and your left. Okay, you have about a 2-inch margin on each side to touch the paper. You don't want to reach inside there or underneath, because that is considered sterile. Okay. So we will open the gloves. We can just reach right underneath, like so. And they're a little tricky to open up right away, so you just want to be careful you're not touching inside or beyond the folds in the paper when you're trying to flatten it out. Like I said, I had to practice this a couple times to kind of get it right. And this is one of those things that comes with practice and experience. So you want to start with your dominant hand. When I've done this, I like to start with my right hand, obviously, and glove that one up first, because that's where the strength is going to be. So this cuff here, you can touch that, because that's going to be inside the hand, or it's going to be what's touching the hand. So okay. Bring your thumb in, so it's like a scooping motion, and it doesn't get stuck on anything, and then just pull it down. Okay. Now reach underneath. You can touch this because this glove is sterile. Kind of lift up this bottom portion here, and put your hands underneath it. Okay. You can keep your thumb out when you're doing this, and you're pushing it on. Bring your thumb in, and then pull it down, and just adjust it. Oh, sorry, because you didn't see that one. I'll show you again on this hand. And then just pull it down and it will fit on there nicely. Take the other one and pull it down. And then you can straighten it out and make it so that it is comfortable and form-fitting. And then after this, keep your hands, I like to keep my hands together just like this. You want to keep your hands above the waist because anything below the waist is considered contaminated. And then when it comes time to take them off,